Good day. Today we focusing on basic life support. Based on European Resuscitation Council Guidelines 2021, Basic Life Support. 5 Key Messages for Basic Life Support 2021. 1. How to recognize cardiac arrest. 2. How to alert an emergency service. 3. Chest compression. 4. AED automated external defibrillator. 5. Learn to do CPR. How to recognize cardiac arrest. Start CPR in any unresponsive person with absent or abnormal breathing. Slow, labored breathing, also called agonal breathing, should be considered a sign of cardiac arrest. Agonal breathing is an abnormal breathing pattern observed in about 50% of cardiac arrest victims. It indicates the presence of brain function and is associated with improved outcomes. Agonal breathing is commonly misinterpreted as a sign of life. A short period of seizure-like movements can occur at the start of cardiac arrest. Assess the person after the seizure has stopped. If unresponsive and with absent or abnormal breathing, start CPR. Note: it is important to underline that the risk of delaying CPR for a cardiac arrest victim far outweighs any risk of performing CPR on a person not in cardiac arrest. How to alert the emergency services. Alert the emergency medical services, EMS, immediately if a person is unconscious with absent or abnormal breathing. A lone bystander with a mobile phone should dial the EMS number, activate the speaker or another hands-free option on the mobile phone and immediately start CPR assisted by the dispatcher. If you are a lone rescuer and you have to leave a victim to alert the EMS, activate the EMS first and then start CPR. Note: the practical question of whether to call first or do CPR first has been debated and is particularly relevant when a phone is not immediately available in a medical emergency. As mobile phones have become the dominant form of telecommunication, calling the emergency services does not necessarily mean delaying CPR. High-quality chest compressions. Chest compressions are the key component of effective CPR as the widely available means to provide organ perfusion during cardiac arrest. Start chest compressions as soon as possible. Deliver compressions on the lower half of the sternum, in the center of the chest. Compress to a depth of at least 5 cm but not more than 6 cm. Compress the chest at a rate of 100 to 120 per minute with as few interruptions as possible. Allow the chest to recoil completely after each compression, do not lean on the chest. Perform chest compressions on a firm surface whenever feasible. Note: the effectiveness of chest compressions is dependent on correct hand position and chest compression depth, rate, and degree of chest wall recoil. Any pauses in chest compressions mean pauses in organ perfusion, and consequently need to be minimized to prevent ischemic injury. Rescue breaths. Alternate between providing 30 compressions and 2 rescue breaths. If you are unable to provide ventilations, give continuous chest compressions, hand-only CPR. Automated external defibrillator, find an AED. Compressions before defibrillation. Continue CPR until an AED, or other defibrillator, arrives on site and is switched on and attached to the victim. Do not delay defibrillation to provide additional CPR once the defibrillator is ready. When and how to use an AED. As soon as the AED arrives, or if one is already available at the site of the cardiac arrest, switch it on. Attach the electrode pads to the victim's bare chest according to the position shown on the AED or on the pads. If more than one rescuer is present, continue CPR whilst the pads are being attached. Follow the spoken, or visual, prompts from the AED. Ensure that nobody is touching the victim whilst the AED is analyzing the heart rhythm. If a shock is indicated, ensure that nobody is touching the victim. Push the shock button as prompted. Immediately restart CPR with 30 compressions. If no shock is indicated, immediately restart CPR with 30 compressions. In either case, continue with CPR as prompted by the AED. There will be a period of CPR, commonly 2 minutes, before the AED prompts for a further pause in CPR for rhythm analysis. Fully automatic AEDs. If a shock is indicated, fully automatic seats are designed to deliver a shock without any further action by the rescuer. The safety of fully automatic AEDs have not been well studied. Safety of AEDs. Many studies of public access defibrillation have shown that AEDs can be used safely by bystanders and first responders. Although injury to the CPR provider from a shock by a defibrillator is extremely rare, do not continue chest compression during shock delivery. Safety. Make sure you, the victim and any bystanders are safe. Lay people should initiate CPR for presumed cardiac arrest without concerns of harm to victims not in cardiac arrest. Lay people may safely perform chest compressions and use an AED as the risk of infection during compressions and harm from accidental shock during AED use is very low. How technology can help. EMS systems should consider the use of technology such as smartphones, video communication, artificial intelligence, and drones to assist in recognizing cardiac arrest, to dispatch first responders, to communicate with bystanders to provide dispatcher-assisted CPR and to deliver AEDs to the site of cardiac arrest. CPR feedback devices. 3 types of feedback devices were identified. 1. Digital audio-visual feedback including corrective audio prompts. The potential benefit from real-time audio-visual feedback would be their ability to improve CPR quality. 2. Analog audio and tactile clicker feedback for chest compression depth and release. 2 very low certainty RCTs evaluated the effect of a clicker device on ROSC and found significantly improved outcome in the group treated with the clicker device. And 3. Metronome guidance for chest compression rate. Observational study evaluated the effect of a metronome to guide chest compression rate during CPR before ambulance arrival found no benefit in 30-day survival. International Liaison Committee on Resuscitation suggested the use of real-time audio-visual feedback and prompt devices during CPR in clinical practice as part of a comprehensive quality improvement program for cardiac arrest designed to ensure high-quality CPR delivery and resuscitation care across resuscitation systems, but suggested against the use of real-time audio-visual feedback and prompt devices in isolation. Learn to do CPR step by step. 1. Safety. Make sure of scene safety. 2. Check for response. 3. Open the airway. Position victim on their back. Do head tilt chin lift with hand on their head and fingertip in their chin to gently open the airway. 4. Look, listen, and feel for breathing for 10 seconds. 5. If breathing is normal, place them in recovery position. 6. If breathing is abnormal or absent, alert for emergency response. Find AEDs. Start chest compression. 7. Start chest compression. Knee by the side of victim. Press the heel of one hand to center of chest, position at lower half of the sternum, put another heel of the hand on chest, and interlock the fingers. Keep arms straight. Compress to a depth of at least 5 cm but not more than 6 cm. Compress the chest at a rate of 100 to 120 per minute with as few interruptions as possible. Allow the chest to recoil completely after each compression, do not lean on the chest. 8. Combine rescue breathing with chest compression, if you are trained to do. Using head tilt chin lift, open the victim's mouth. Take a normal breath, and place your lip around the victim's mouth. Blow steadily into the victim's mouth, and observe the victim chest rise 1 second as in one normal breathing. This is effective rescue breathing. Continue chest compression and rescue breath in a ratio of 30 to 2. Do not interrupt chest compression for more than 10 seconds. 9. Hand-only CPR, if you are untrained or unable to rescue breathing. 10. When AED arrives, switch on the AED. Attach electrode patches to the victim's bare chest according to the position shown on the AED or the pads. 11. Follow the spoken or visual direction of AED. If shocked advice, ensure that nobody is touching the victim. Push the shock button as prompted. Immediately restart CPR with 30 compressions. If no shock is indicated, continue CPR with 30 compressions. 12. If no AED, continue CPR. 13. Sign that victim has recovered. Waking up. Moving. Open eyes. Breathing normally. 14. Do not interrupt CPR until a health professional tells you to stop CPR or the victim is definitely has recovered or you become exhausted. Learn basic life support to save more life. Need more information? Please contact 012-235-888, Emergency Department, Royal Anchor Hospital. Or contact 099-991-222, Emergency Department, Royal Phnom Penh Hospital. Thank you for your attention.